Colon or colorectal cancer is any cancer involving the large intestine and/or rectum and can be as painful as that sounds. Sometimes abnormal growths, called polyps, form in the colon or rectum. Over time, some polyps may turn into cancer. Today, we will tell you about 10 warning signs of colon cancer you shouldn't ignore. Ten. Blood in stools. If you find blood on or mixed in with your stools, this could be a sign that you have colon cancer. Your doctor will send a stool sample for a laboratory analysis called a fecal occult blood test. Silent sign: thin, bloody stools. In addition to constipation and diarrhea, any other changes in stools can be a sign of colon cancer. Stephen Reisman, MD, director of New York Cardiac Diagnostic Center, specifies that narrow or thin stools, or those with blood in them, red or black, are things to look out for. These symptoms can represent a tumor blocking the colon or bleeding into the colon, he explains. The RX, unusual BMs: if you notice any abnormality in your stool, especially blood, you should see a gastroenterologist and arrange a colonoscopy. And if you do receive an IBS diagnosis and your bowel movements don't seem to improve after treatment, go back for a second opinion. 9. Change in stools. Stools are very dark in color or even black and sticky, then this could be caused by bleeding due to colon cancer. Significant changes in bodily functions can indicate colon, prostate, or bladder cancer, among other cancers. Warning signs include persistent constipation or diarrhea, black or red blood in your stool, black tarry stools, more frequent urination, and blood in your urine. Occasional bowel changes can be caused by a dietary change, disagreeable food, or a viral bacterial infection. 8. Rectal bleeding. Bright red blood in the stool typically indicates that there is bleeding in the rectum or colon, which may be a sign of colon or rectal cancer. Rectal bleeding can also be caused by hemorrhoids. Typically, patients with hemorrhoids experience symptoms that come and go with flare-ups, whereas rectal bleeding caused by cancer usually continues or worsens and is more likely to be accompanied by pain. Although blood in your stool could be caused by hemorrhoids, it can also indicate something more serious, including colon cancer. Blood is usually bright red and it can be found in the toilet bowl or on the toilet paper. We all feel bloated now and then, but bloating for more than 2 weeks can be a sign of ovarian cancer as well as various gastrointestinal cancers. One of the most disturbing symptoms of colon cancer can be bleeding from the rectum or blood in the toilet. Conditions such as hemorrhoids or fissures can also cause small amounts of blood. So if you notice blood, contact your physician and be sure to explain any other symptoms that you may be experiencing at the same time. A large amount of blood may warrant a visit to the emergency room. The way your stool looks can be a good indicator of what is going on inside your body. Small, hard stool is an indicator of constipation. But if you notice one of these other changes, contact your physician. If your stool becomes thin, narrow, or ribbon-like, this could be an indication of changes inside your colon. Contact your healthcare provider to have the condition evaluated. 7. Trouble passing stool. The constant feeling that you need to have a bowel movement and the feeling is not relieved by having one could indicate changes in your colon, preventing a complete bowel evacuation or the feeling of stool remaining even if the bowel is empty. Contact your physician to be evaluated and determine the cause. Changes in passing of stools is a symptom of colon cancer. You may experience a feeling of completely passing a stool, or you may feel the urgent need to have a bowel movement, and then you realize that there is no stool to be passed. In some cases, bowel cancer can stop digestive waste passing through the bowel. This is known as bowel obstruction. Small, hard stool is an indicator of constipation. But if you notice one of these other changes, contact your physician. 6. Anemia. Anemia is a shortage of red blood cells in the blood. It can happen from blood loss from colon cancer. Symptoms of anemia are feeling tired a lot of the time, weak, and short of breath. Your skin may also look pale. Anemia or a lack of iron can be a symptom of colon cancer. This is due to the gradual loss of blood in the stool, says William Tierney, MD, OU Medicine gastroenterologist. The bleeding is very slow and is not visible on the bowel movement, so it is silent but occurs continuously over months to years, leading to depletion of the body's iron stores. Stay up to date on your blood work. Iron deficiency in any male and any non-menstruating female warrants a search for blood loss in the gastrointestinal tract, and colon cancer is a common cause, Dr. Tierney says. 5. Abdominal pain. A certain amount of abdominal discomfort is a normal experience at times. However, if you often suffer from gas, cramping, and bloating, then you could be more likely to develop colon cancer. If you notice any hardness around your belly button, don't ignore it. A hard knot at the belly button could be a Sister Mary Joseph node, explains Dr. Booth. In addition to being a sign of colon cancer, it can also be a sign of another cancer in the abdomen that has spread outside of the colon. Since this symptom can imply a variety of cancers, call your physician as soon as you notice hardness at the belly button. If you are feeling discomfort, pain, or cramping in your midsection and it won't seem to go away, you should not ignore it. If this lasts for a significant amount of time, more than a week, or gets progressively worse, it may represent a tumor in the colon, explains Dr. Reisman. Pain and cramping in the abdominal region can represent a variety of health issues. Dr. Reisman suggests making an appointment with your gastroenterologist to schedule a colonoscopy to rule out colon cancer. 4. Weight loss. Even if you have a normal diet, colon cancer can result in weight loss. Alternatively, you may experience complete loss in appetite. If you are losing weight and have no explanation for it, it could be a sign of a variety of different cancers, including colon. If you have any other symptoms, especially a change in stools, you shouldn't ignore the numbers going down on the scale, says Dr. Reisman. Consult a physician for an evaluation for weight loss, instructs Dr. Reisman. 3. Constipation. While it is common for people to experience a change in their bowel habits from time to time, there are some changes that should be evaluated by a physician if they persist. If you notice any of these changes to your bowel habits, take note of when the changes began to occur and any other lifestyle changes that may have occurred at the same time. Constipation lasting more than a few days can be associated with colon cancer. Chronic or ongoing constipation may even increase your risk of developing colon cancer. As the tumor grows, it can cause the diameter of the colon to become smaller and smaller, making it harder to pass stool through the colon, explains Christina Booth, MD, OU Medicine colorectal surgeon. This can result in less frequent bowel movements and in some cases narrowing of the stool too. Constipation is defined as having less than 3 bowel movements in a week and is one of the most common gastrointestinal complaints. Having constipation, however, does not mean you have colon cancer. A change in your diet, poor nutritional habits, stress, dehydration, or lack of physical activity can also cause constipation. Physicians generally recommend that if you have constipation for more than 2 weeks, you should see your doctor so a cause can be determined. 2. Diarrhea. Colorectal cancer might not cause symptoms right away, but if it does, it may cause one or more of these symptoms. A change in bowel habits, such as diarrhea, constipation, or narrowing of the stool, that lasts for more than a few days. A feeling that you need to have a bowel movement that is not relieved by having one. Persistent diarrhea is often a symptom of colon cancer. Tumors in the right colon are likely to bleed and cause diarrhea, explains Dr. Beatriz Amendola of Innovative Cancer Institute of Miami, Florida. She points out that younger patients are more likely to be misdiagnosed for IBS, irritable bowel syndrome. Loose stool and diarrhea are common occurrences. The condition can be caused by intolerance to certain foods, medication, stress, or exposure to bacteria, often experienced when traveling. Most people will get at least a mild case of diarrhea several times per year. In most cases, the condition will resolve itself within 2 to 3 days. Your healthcare provider should investigate diarrhea that lasts more than 3 days. 1. Nausea and vomiting. Persistent nausea and vomiting for no apparent reason may be a symptom of colon cancer. While losing your appetite for no explainable reason could be due to so many health issues or cancer, if it is paired with other colon cancer symptoms, especially a change in bowel habits, it shouldn't be overlooked. Weakness and fatigue may be a really common part of your day. However, they can be symptoms of iron deficiency anemia, a symptom of colon cancer, reminds Dr. Reisman. If you are feeling tired and weak all the time, you should make an appointment with your MD to have blood work done. While anemia in and of itself isn't a huge concern, it could be a symptom of a greater health issue, such as colon cancer. Do share with us in the comment if you know about any other symptom. Please subscribe to Health Awareness. Thanks for watching.